CDC Director Dr. Robert Redfield considers the opioid epidemic the public health crisis of our time. Preliminary CDC data shows the number of deadly drug overdoses nationwide has plateaued for 6 straight months. Still, more than 72,000 Americans died last year from drug overdoses. A little over 48,000 of those deaths were from opioids. We spoke to Dr. Redfield about why the crisis hits close to home for him. He also explains how the CDC is ready to expand its research into the causes of gun violence, but is waiting for Congress to provide the money to do so. In terms of priorities, the Secretary of HHS said that he would instruct the CDC to conduct research on the causes of gun violence. Has he done that?
We have a program called the National Violent Surveillance System, and so we currently are recording violent deaths from all causes, including firearms. And so that's ongoing. What,
in your mind, constraints are there from the Dickey Amendment?
I don't feel we have any restrictions to do research. The issue will be if Congress can give us funding to expand the research that we're currently able to do. The Secretary has also made it clear that we do not have a restriction to do research. Basically, what we need to do is get a funding mechanism for Congress to instruct us to do that research.
If you were doing that priority list, how high up on the list would the causes of gun violence be when you're asking for money and saying, you know, we need the money to do the proper amount of research?
Well, I think it's in the mix. You'll find at CDC our programs are largely driven by where Congress puts the priority to want to fund us.
You're not silent in that conversation. You could say, there are tens of thousands of deaths in America that result from this. We'd like some money to know how to be able to actually...
I think people know that we're poised to be able to do research in this area if Congress chooses to give us additional funding.
CDC has released some preliminary data on opioid overdose deaths. It seems to have maybe plateaued. Where are we right now?
You know that we had over 72,000 people die last year from drug overdose. A little over 48,000 of them for opioids. It's going to require enormous effort to get this epidemic under control.
Is it that we don't know how to attack the problem, or that we don't know how to execute a plan to go after it?
Well, I think first and foremost, we have to recognize it for what it is. It's a medical condition. It's not a moral failing, right? And the second thing we have to recognize is it's actually a chronic medical condition. It's personal to me. I think you know one of my 6 children almost died from cocaine that was contaminated with fentanyl. You know, I try to encourage people to support families like us that are trying to win the battle against opioid addiction. Recognize that treatment success is possible. It should become the rule, not the exception. You know, I think my wife and I have a very supportive family, but my own son was in tears when he finally told us that he was using cocaine. And I didn't understand, you know, why didn't he come earlier? Well, because he was made to feel shame. You know, who knows why he started using cocaine? You know, we now know that 2 to 6% of people that get a single prescription for an opioid, like for a wisdom tooth or something, become chronically dependent. There's a pathophysiological reason for addiction. And the more we can embrace that, not make people feel bad about it. You know, we don't make people feel bad if they have cancer. We have to allow people to embrace the medical illnesses they have and help them get the best therapy, treatment, so that they can go on to a productive and happy life.
You know, the point he was making is reducing the stigma for people with an opioid condition, and that's important for those with it, but also, we talked about, you know, my own kids, creating the conditions for conversation so that if this happens in your family, you don't have a situation where you say, oh my gosh, where did this come from?
Well, it's a big help removing the stigma when the head of CDC says, listen, it happened to me. Yeah. That's very brave of him to share. Did you know that going in, that he had that in his family?
Yeah, but he was, you're right though, and but he is really anxious to get the message out there because you know, he really wants to be able to get people to understand that changing the stigma is important. Another thing he said is Fortune 500 companies are as important as the medical field because they can provide jobs, because it's so difficult if you have this condition, getting treatment and then getting back into a productive job that gives your life meaning so that you don't seek it from other places.
It's a reminder that he, like so many others, have 2 jobs, right? He's got his job at the CDC and then his most important job as a parent.
You got it.